Have you looked in the mirror lately and thought your lips just aren't as full as they used to be? Or the space between your nose and your top lip is getting a little bigger? Well, you're not imagining it. And as Dr. Ann-Therese Stubbs of Ann-Therese Aesthetic Medicine is here to tell us, fixing these aging effects is about much more than vanity. So hi, Dr. Ann.
Thanks for having me. Good to see you.
So the lips really are how we communicate. So we want to make sure that they show how we feel, don't we?
Exactly. And we've looked in the aesthetic literature that the two nonverbal communicators on a woman's face that project her feelings the most are her eyebrows and lips. So when you look across the room, those are the first thing you hone in on, someone's eyebrows and lips, so we want to preserve them.
We definitely do. So what happens to our lips as we age?
Well, tragically, the upper lip gets thinner and it starts to curl in a little bit, and then the skin right on top of the upper lip tends to thin, so we can get what are called smoker's lines. They're really not smoker's lines. People get them who've never smoked a day in their life, but basically the pucker muscle works over time as we age, you know, straws, water bottles, anything we use that muscle for. And then the skin over top tends to thin. So we get those little, some people call them barcode lines, little vertical lines above the lip. And then the ends of the mouth tend to turn downward as we age too.
So what exactly can be done to treat all these different areas? Because there's, like you said, the smoker's lines, the downward, there's different areas that you want to probably treat differently, right?
Exactly. And so we first take a look at the volume around the lips. And so if you've lost a lot of volume right over top and we see those vertical lines, I think that's probably the most common complaint. The first thing we'll do is put a little bit of Botox or Dysport, the muscle relaxer, just 1 unit or 2 units right above the lip, and we can use it right under the lip too. And that small dose softens that muscle contraction a little bit, so you can still talk as fast as I'm talking, you can still use a straw, you can still use a water bottle, but those lip lines, the vertical lines, are softened with that. That's kind of a first line approach, very affordable, maybe $20 to $30, and we see if that gives the patient relief of those little lines.
And those are called dermal fillers, right?
The Botox and the Dysport are actually muscle relaxers. The next thing we go to is the dermal fillers.
Okay, gotcha.
We add
so
the
these
volume.
are different. Okay.
Yes, the dermal fillers are hyaluronic acid. They're Restylane, Juvederm, Restylane Silk is the newest one that's newly out for lips alone, and it's remarkably soft, and there are no lumps. It's very subtle, and so a lot of people who don't want big, you know, lips to kind of that protrude, they just want kind of a little enhancement or the little vertical lines gone. Silk is their best friend.
Now, we're going to look at a couple of before and afters to kind of show what a difference even doing something minimal can make for ladies and gentlemen in either way. So what have these folks undergone?
The gal on the top has had a little lip, we call it lip augmentation with hyaluronic acid filler, Restylane. So she basically got a little more volume in the lower lip and the upper lip, and you can see the border looks a little crisper in the second picture below too. So we tend to lose or flatten what's called the philtral columns, that little Cupid's bow, as we age too. So sometimes we can crisp that just a little bit with a little bit of filler. And I think when you look at the picture on the left, you see that it's very subtle. She still has the same general shape, just a little more volume, and maybe what she had 5 years ago. And it's very subtle, and that's what women in Columbus, Ohio tend to like.
And that's what I like that you said. The best part is that you want people to not know that you got something done. You want them to just say, hey, you look younger.
Right, you look better, and we want them to feel better about the way they look without it being you walk into a room and your lips enter before you do. We're not up for that type of look. We want a very natural look, and that's what these products do. Minimal amounts, very soft. They can have a little swelling maybe for a day, so I tell people plan it on a day. You don't have a fabulous dinner party that night, but usually within 24 hours the swelling goes down and you put your lip gloss on and lip lines are gone.
Should somebody expect a little bit of pain? I know you mentioned swelling, but is the treatment pretty easy?
It's very easy. We try to make this as comfortable as possible. There are a lot of nerve endings in the lips, so we do put a topical numbing cream when patients come in. So they sit for about 15 minutes with that on the lips and the kind of the area around the lips, and that numbs the skin very effectively. And then the actual gel, the Restylane or the Silk that we're injecting, has a little bit of lidocaine in it. So maybe might feel a little pinch the first time, but then when the lidocaine is in the lip itself, the next few injections don't hurt much at all. We also use some cold air and ice, so people are very comfortable throughout.
All right, Dr. Ann, you're offering a great deal as always to give people some incentive. The consultation is free, but then you are putting it on top of that, especially for Valentine's Day.
Yes, we always do a complimentary consultation because people don't know exactly what they need and they hear a lot of different things, see ads. So we like to talk with you first, see what your goals are. And then normally fillers range from $600 to $750 per syringe, and we're doing $400 a syringe so people can try the lip fillers out for Valentine's Day and get their luscious lips back.
That's exactly what we want. All right, we have the phone number up on screen, of course, so somebody can get started. Thanks, Dr. Ann.
Thanks for having me.